Delirium. Introduction. Delirium is an acute and fluctuating disturbance in attention, awareness, and cognition. It is commonly observed in hospitalized patients, especially the elderly, and is often caused by underlying medical conditions, infections, medications, or substance withdrawal. Delirium is a medical emergency that requires prompt identification and management to prevent complications and improve patient outcomes. Definition. American Psychiatric Association, APA. Delirium is a disturbance in attention and awareness that develops over a short period, representing a change from baseline cognition and fluctuating in severity. World Health Organization, WHO. A transient, usually reversible, global disorder of cognition and attention, caused by an underlying medical condition. Risk factors. Age, more common in elderly individuals. Hospitalization, ICU stays and post-surgical conditions increase risk. Medical conditions, infections, metabolic imbalances, and neurological disorders. Medications, polypharmacy, sedatives, and anticholinergic drugs. Substance use, alcohol withdrawal or drug intoxication. Sensory impairments, vision or hearing deficits. Etiology. Infections, urinary tract infections, pneumonia, and sepsis. Metabolic imbalances, electrolyte disturbances, dehydration, hypoxia. Neurological causes, stroke, head trauma, dementia. Medication effects, adverse drug reactions, sedatives, opioids. Substance withdrawal, alcohol, benzodiazepines. Surgical procedures, postoperative cognitive dysfunction. Types of delirium. Hyperactive delirium, characterized by agitation, restlessness, hallucinations, and aggressive behavior. Hypoactive delirium, marked by lethargy, reduced motor activity, and confusion, often mistaken for depression. Mixed delirium, a combination of hyperactive and hypoactive symptoms, with fluctuations in behavior. Pathophysiology. Neurotransmitter imbalance. Decreased acetylcholine and increased dopamine levels disrupt cognitive processing. Down arrow. Inflammatory response activation. Systemic infections, trauma, or illness trigger cytokine release, affecting brain function. Down arrow. Reduced cerebral blood flow. Hypoxia and impaired perfusion lead to neuronal energy deficits and dysfunction. Down arrow. Metabolic and electrolyte imbalances. Dehydration, hypoglycemia, and acid-base disturbances further impair neuronal activity. Down arrow. Disruption of sleep-wake cycle. Altered melatonin secretion and circadian rhythm dysregulation contribute to confusion. Down arrow. Reticular activating system dysfunction. Impairment in attention and arousal regulation leads to fluctuating consciousness. Down arrow. Acute cognitive and functional decline. Sudden onset of confusion, disorientation, impaired memory, and reduced awareness. Clinical manifestations. Sudden onset of confusion and disorientation. Fluctuating attention and awareness. Disorganized thinking and incoherent speech. Hallucinations or delusions. Sleep-wake cycle disturbances. Agitation or lethargy, depending on the type of delirium. Diagnostic evaluation. History and physical examination, assess patient history to identify risk factors and underlying causes of delirium. Confusion assessment method, CAM, a standardized diagnostic tool used to evaluate acute mental status changes. Cognitive testing, Mini Mental State Examination, MMSE, or Montreal Cognitive Assessment, MoCA, helps assess cognitive function. Laboratory tests include CBC, electrolytes, liver and kidney function tests to detect metabolic or systemic causes. Imaging, CT scan or MRI is performed if neurological conditions like stroke or tumor are suspected. Medical management. Treat underlying cause, identifying and addressing the primary cause of delirium, such as infections, example pneumonia, urinary tract infections, dehydration, or metabolic imbalances, example electrolyte disturbances, hypoglycemia. Prompt treatment of these conditions can help resolve delirium symptoms. Medication review, evaluating the patient's current medications to identify drugs that may contribute to delirium, such as sedatives, anticholinergics, or opioids. Adjusting dosages or discontinuing these medications can help reduce delirium severity and prevent further cognitive decline. Pharmacological treatment, in severe cases where agitation, hallucinations, or aggressive behavior pose a risk to the patient or caregivers, low-dose antipsychotics like haloperidol or risperidone may be prescribed. However, these are used cautiously and for a short duration to minimize side effects. Supportive care, ensuring proper hydration, balanced nutrition, and adequate oxygenation to maintain physiological stability. Encouraging mobility, providing a calm environment, and involving family members in patient care can further aid in recovery and prevent complications. Nursing management. Nursing diagnosis, acute confusion related to altered mental status. Interventions. Reorient the patient frequently using clocks, calendars, and familiar objects. Provide a calm and structured environment. Ensure adequate hydration and nutrition. Nursing diagnosis, risk for injury related to impaired cognition. Interventions. Supervise ambulation to prevent falls. Use bed alarms and restraints only when necessary. Minimize environmental overstimulation. Nursing diagnosis, sleep pattern disturbance related to altered consciousness. Interventions. Promote a regular sleep-wake cycle. Reduce nighttime disturbances. Avoid sedatives unless absolutely needed. Prevention. Early mobilization post-surgery. Avoid unnecessary sedation and polypharmacy. Maintain hydration and electrolyte balance. Encourage cognitive stimulation and social interaction. Complications. Increased hospital stays and healthcare costs. Long-term cognitive decline or progression to dementia. Increased risk of falls and injuries. Higher mortality rates in critically ill patients. Conclusion. Delirium is a serious but often preventable condition that requires prompt identification and management. A multidisciplinary approach, including medical treatment, nursing care, and preventive strategies, plays a crucial role in improving patient outcomes and reducing complications.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.